Hello, my name is Tyler Smith, and I am a student physical therapist at Campbell University. And today I will be demonstrating how to perform classic ankle support taping. First, we'll talk about the anatomy of the ankle joint. It's a hinged synovial joint that formed by the tibia and fibula that allows plantar flexion and dorsiflexion of the foot, and with the latter allowing more stability due to the wider portion of the talus. There are several ligaments that span this joint to provide it with stability and prevent excessive inversion and eversion. On the medial side of the ankle, we have the deltoid ligament, originates from the medial malleolus and spreads out to form 4 separate insertion sites attaching to the talus, the calcaneus, and the navicular bones. On the lateral side of the ankle, there are 3 different ligaments that make up the lateral ligament as a whole. The anterior talofibular ligament originates at the lateral malleolus and inserts at the lateral portion of the talus. The posterior talofibular ligament also originates at the lateral malleolus and inserts at the posterior portion of the talus. The calcaneofibular ligament also originates at the lateral malleolus and inserts on the calcaneus. The mechanism of injury for the majority of ankle sprains is the result of excessive eversion of the foot with weight bearing during plantar flexion, with the anterior talofibular ligament being the most often sprained and higher risk for injury. Ankle sprains can often result in partial or complete tears of ligaments and avulsion fractures of the lateral malleolus, for example. A person often reports an audible popping sound with immediate pain with inflammation shortly after the injury that often results in bruising as well. They may also report instability of the joint during weight-bearing activities. So ankle support taping is just a means of providing restraint to excessive ankle motion to individuals while they're recovering from mechanical instability due to a ligament sprain and prevent further injury. All right, Mr. Patient, so based upon your injury that you had and some tests that I did, it seems to me like you have a lateral or ATFL sprain of your ankle, which is located about right here on the foot, and I think it's just a sprain is what's going on. So what I'm going to do is I'm going to apply some tape. It's called a classic ankle support taping. Athletic trainers do it to help provide stability around the ankle joint so that when you're recovering from your injury, it's going to prevent excessive motion that would re-injure your ankle again. Does that sound okay?
Sounds great.
So today we're going to do the classic support ankle taping. First we'll start at the top of the ankle with the pre-wrap, so we'll come around and start right here, go more distally with it. Tore a little bit, that's all right. We'll stop right there on the patient's foot. We'll cover that up with tape. So next we're going to apply the 3 anchor strips at the top of the ankle. I'm going to ask the patient to hold this right here, if he can, with his hand. Right. Let's apply another anchor strip along the bottom of the foot. Let's go ahead and apply one more. Alright, thank you. Next, we'll come around the medial side of the ankle and we'll apply our stirrups. So with the stirrups, we're overlapping by a half width of each strip and going more laterally to apply more stability to the lateral side of the ankle. Okay. So we have our stirrups. Next, we will apply horseshoes. around the back side of the ankle. I'll apply 3 of them. All right, horseshoes, and next we will do a figure 8 with a heel lock method. So starting on the medial side of the foot, back side of the ankle, over top, come around the bottom of the heel, and over top again for the heel lock. So one more time, medial side of the foot, lateral behind the foot, over top again, bottom side heel, over top again of the foot, stop. All right, so that's the figure 8 with the heel lock method. And we'll just cover up areas that are uncovered by the tape, just to make sure the pre-wrap isn't showing. There you have it, classic support ankle taping. A study published by the Journal of Athletic Training in 2002 provided rationale for the use of ankle taping based upon inversion and eversion mechanics of the foot. The Gibney basket weave technique has been around since 1895 and has often been used as a means of providing mechanical stability for the ankle. Additionally, the stirrups that are applied during this technique provide significant restraint to inward displacement of the hind foot within the frontal plane. Moreover, using heel lock and figure 8 method helps to further encase the hind foot, which provides additional resistance to lateral distraction of the talocrural and subtalar joints within the frontal plane. So the majority of athletic trainers use a combination of the basket weave, the heel lock, and the figure 8 wrapping pattern during ankle support taping. Another review published by the British Journal of Sports Medicine in 1990 examined a study that showed a reduction in ankle sprains with college intramural basketball players with taped ankles in comparison to untaped ankles. So out of the 2,500 players that were studied, taped ankles had an injury rate of about 14.7 per 1,000 player games, compared to untaped ankles, which had an injury rate of about 32.8 sprains to 1,000 player games. However, the restrictive effect of taping is often lost or significantly reduced after several minutes of exercise. So it begs the question, how does classic ankle support taping provide stability to the joint whenever it becomes more loose around the ankle? Well, another review published by the British Journal of Sports Medicine later on in 1997 explained other mechanisms that were responsible for providing this stability. So, and based upon experimental work done on the peroneal muscle group on the lateral portion of the ankle and lateral ligaments of the ankle on patients in 2 different studies, the review stated that functional or chronic ankle instability can be prevented through proprioceptive or tactile input to stimulate firing of the peroneal muscle group and prevent lateral ankle sprains.